All right, we're going to go ahead and get started. Good morning, and thank you for joining us today. This briefing is being streamed live on the Rock County Public Health Department's Facebook page. It will also be uploaded to our YouTube page once the briefing ends. We will be hearing some COVID-19 updates from our panelists first, and then we will open it up to questions from the media. Today on our panel from the Rock County Public Health Department, we have epidemiologist Nicholas Zupan. We have Rick Wiederson, our environmental health manager, and Felicia Martinez, public health nurse. I will now turn it over to Nick Zupan, Rock County Public Health Department's epidemiologist, for some data updates.
Thanks, Seth. So just want to provide a brief look at the data where we are in terms of our COVID spread since last week and where we're headed. So just to give you a sense of the case activity, we continue to see a drop in case activity. Around 14,336 Rock County residents have tested positive for COVID-19. And this is an increase, a weekly increase of about 100 cases. So as I said, we're continuing to see nice declines in the number of new cases that are being reported to the health department on a daily basis. At this point, we're averaging about 15 new cases per day. And these are levels that we haven't seen since about August and early September. Based on the information that we have, we're estimating that there are about 208 active cases in the community. Our hospitals are also reporting continued positive trends. As of yesterday, there were 7 patients in the hospital getting care for COVID-19. Over the last 2 weeks, we've averaged about 12 patients in the hospital on a given day getting care for COVID-19. These numbers have also fallen quite a bit and are at levels we've seen kind of in the late summer, early fall. In terms of the number of people who have gotten vaccinated so far, we have just under 24,000 Rock County residents who have gotten that first dose of the vaccine, and just over 11,000 Rock County residents have gotten the second dose of the vaccine. We have seen about 13,000 adults who are 65 and older get that first dose of the vaccine, which is almost 50% of the 65 and older population in Rock County. And those who've gotten the second dose who are 65 and older were just under 3,000, which is about 10% of the total population in that age group. So this week, we just started to see an increase in the 65 and older population who are getting that second dose. This is the first week that they were actually eligible based on the time frame of when they were eligible for the first dose. So we will expect to continue to see the number of 65 and older adults getting that second dose continue to increase. So that's the brief data update, and I'll turn it back over to you, Seth.
Great, thank you, Nick. Now we will go to Rick Wiederson from the Rock County Public Health Department. Rick?
Thanks, Seth. Our main topic today, we want to talk about the Rock County Community Vaccination Clinic at Blackhawk Technical College. And I'd like to just give a brief summary and refresh everybody's memory. The clinic out at Blackhawk Tech is sponsored by the state of Wisconsin Department of Health Services and is run by their contracted vendor, AMI. We started with a soft launch last week on Tuesday, February 16th, and last week approximately 1,000 individuals were vaccinated. This week, things got off to a little bit of a slow start due to some nationwide disruption of the vaccine distribution pipeline. So the first 2 days, Tuesday and Wednesday, we were only able to provide doses to the people that needed second doses from the National Guard wing clinic that we did 4 weeks ago. So it was scheduled that there would be 1,000 initial doses this week and about 900 second doses. I'm happy to report that we did finally receive the vaccine yesterday, and the scheduled vaccines for today, tomorrow, and Saturday are on target, and next week also things will be on schedule. So it's anticipated that we will continue that site at 1,000 doses per week until the vaccine supply can be increased. That site has the capabilities of doing up to 1,000 doses per day when the supply is increased. The vaccine clinic is located at Blackhawk Technical College, 6004 South County G, located between Janesville and Beloit. It is by appointment only, Tuesday through Saturday, 11 a.m. to 7 p.m. Pre-registration is required. Right now, individuals are encouraged to register via the Rock County Public Health Department online form, which is found on our website. The pre-registration process involves screening for eligibility, and priority will be given to people on that waiting list. There is a statewide vaccine registration system that is upcoming and will be available soon. And when that comes out, that'll be another option for people to register for vaccines. The Rock County Public Health Department registration list is shared with our local vaccine providers. And the statewide registration list will also be shared with statewide providers that choose to cooperate with the state system. Both are viable options for people to register for vaccines, and we also encourage people to be in close contact with their primary healthcare providers and local pharmacies. The Rock County Public Health Department will continue to maintain our own vaccine registration list, even when the state system is up and running. And we encourage people to sign up on that list, particularly if they do not have insurance or an established healthcare provider. For those without internet access, we also offer a vaccine registration hotline, and that number is 608-352-6727, 608-352-6727. People that are currently eligible for the vaccine at this time include healthcare workers, first responders, including police and fire, and people over 65 years of age. And the state has announced that beginning March 1st, there'll be new groups that'll be eligible to receive vaccine and encouraged to register. And those groups include education and childcare staff, individuals enrolled in Medicaid long-term care programs, some public-facing essential workers such as 911 operators, utility and communication infrastructure workers, public transit workers who have close contact with the public, and food supply chain workers. Additional groups include non-frontline essential healthcare personnel and facility and staff living at congregate living settings. So again, just to re-emphasize, if people are looking to get a vaccine, be in close contact with their primary healthcare providers, encourage them to contact the pharmacy that they may use on a regular basis. We encourage them to sign up at the Rock County vaccine registration on our website. And soon there will be a statewide vaccine registration for people to get on lists for registering for vaccines. So I'll turn it back over to you, Seth.
Great. Thank you, Rick. We will now go to Felicia Martinez, public health nurse from the Rock County Public Health Department. Felicia.
Hi, and thank you. Again, my name is Felicia Martinez. I'm one of the public health nurses with Rock County Public Health Department. I'm also one of the site coordinators out at our regional testing site at Blackhawk Technical College. Thank you, Rick, for the updates on our vaccine site out at Blackhawk Tech. The vaccine is a wonderful addition to our toolkit in the fight against COVID-19. However, it is critical that we continue to follow CDC, state, and local public health guidelines during this time. The vaccine will make a tremendous difference in disease transmission and how the COVID-19 infection is experienced, but it will not eliminate it entirely. COVID-19 is caused by a coronavirus known as SARS-CoV-2. While risk assessment, mitigation, and management are possible, complete risk elimination is not. The goal is to make it manageable. For the fully vaccinated, serious illness from COVID-19 will be extremely rare. Vaccines will not result in COVID-0, but they are on track to reduce both infection rate and serious disease, and therefore hospitalizations. Right now and for the immediate future, it is crucial that we continue to wear our masks, wash our hands often, and maintain a physical distance of 6 feet or more from those not in our households. Those experiencing symptoms should continue to seek out testing, and anyone exposed to an individual who tests positive should continue to quarantine according to the guidelines. In Rock County, we have our regional testing site out at Blackhawk Technical College. This is a free COVID-19 testing site. It's open from noon to 5 every Wednesday and Thursday through March 10th. The testing site can accommodate tests for anyone 1 year old and older. Pre-registration is strongly recommended, but Wing is on site to help with any registration issues as necessary. The pre-registration website is register.covidconnect.wi.gov. Combined with our vaccine effort, following safety and testing guidelines will help us reach a point where some of the current protocols can be relaxed. Given the novelty of the virus, we can't provide a timeline, but we do know the more elements we combine and the better the adherence to these tactics, the more quickly we will see results. That is why it's more important than ever to remain vigilant. It may be helpful to think of each measure as a slice of Swiss cheese. Each layer, the masking, social distancing, hand washing, staying home when you're feeling ill, getting tested as needed. I'm so sorry, 1 second. And vaccination reduce risk, but it's not perfect all by itself. When layered one atop the other, we get closer to full protection. Everything is where it's just one little piece of each part all works together. Right now, we are seeing a drop in COVID positive numbers, and this drop isn't due to any one thing, but to these combined efforts. If we remain focused, despite the very understandable COVID fatigue, it will pay off. The more we do, the more successful we will be in terms of driving down the numbers, and this in turn will allow us to relax restrictions. Working together, we can get there more quickly. Thank you.
Great, thank you, Felicia. We will now open it up to questions from the media. We ask that you raise your hand and we will allow you to unmute and ask your question. For those joining us via phone, *9 will raise your hand, *6 will mute and unmute your phone once you are called on. And it looks like we have our first question from Austin Montgomery from the Beloit Daily News.
Hi, thanks for taking the time to put this together, guys. Just wanted to ask about the March 1st rollout. Is the county prepared for that expanded vaccine rollout? Are there plans in place for kind of making sure that the new groups that are eligible can also register with the community vaccine site? Just wanted to see if that March 1st date is even feasible, since there are still so many people that need to be vaccinated from the previous group. So just wanted to talk about that March 1st date. Thank you.
Yeah, I can start to answer that. And then maybe Nick, you can come in on that. So yeah, the March 1st date is, some people might say it's a little bit early because we have still about half of our over 65 population that is yet to be vaccinated. However, there are a lot of indications that the vaccine supply will be increasing. And as we get those over 65 and other previous groups vaccinated, the state wants to start blending in these additional groups. So starting out, I don't think people should have a lot of high expectations March 1st that all of those new groups will be able to get appointments and get vaccinated, as there's a lot of people from the previous groups that we need to get through and will have priority. So as time allows and the vaccine supply allows, we will be able to get those people worked in. And Nick, maybe you can talk a little bit about the registration process for those new groups.
Sure, absolutely. So very similar to the process that we have set up for our healthcare worker, first responders, and our 65 and older populations, we do have a new form that individuals can fill out on the Rock County Public Health website, so co.rock.wi.us/public health. And if you navigate to the vaccine page as part of our COVID-19 information, we do have a form now on our website for individuals who will be eligible starting March 1st. And basically the process is the same. We're collecting those individuals' information and sharing those who want to be vaccinated with vaccine providers in Rock County. As Rick said, the priority still is going to be among those who were previously eligible. And those who are eligible March 1st may not get an immediate callback on March 1st, but once they fill out that form and provide their information, they're on the list to be communicated to with a vaccine provider. So we will have an official announcement coming out later today on that.
Great. Thank you, Nick, and thank you, Rick. Looks like we have a question from Ashley McCollum from Janesville Gazette. Ashley.
Hi, everyone. My question is a little bit similar to Austin's, and it does regard the March 1st eligibility groups. The state DHS has said educators should be the top priority as eligibility opens up, but we know many of the Rock County school districts have already been offered vaccine, and many teachers and educators have already been vaccinated, some even with both doses. Excuse me. So how does that change Rock County's approach going into the eligibility groups opening up on Monday?
So in terms of what we can share, and this is in some ways a head start for Rock County in terms of our educators having been vaccinated already. There still is a small subset of those who are educators who haven't been vaccinated, and then we will be looking at our childcare staff who need to be vaccinated. So, we do have a head start there with some of our educators having already been vaccinated. We'll continue to work with our school districts and our childcare sittings to make sure we get all those staff people vaccinated and work through kind of the priority list that was set up by the state health department.
Okay, thank you, Nick. Was there any other questions from the media today? Well, looks like we have another question. We're going to go to Austin Montgomery from the Beloit Daily News. Austin.
Thanks. Just a question about the ongoing operations at Blackhawk Tech for vaccinations. Have any doses had to be disposed of? If so, how many? Is there an average of any doses that have had to be discarded just due to missed appointments or things like that? So thank you.
I can try to answer that question, Austin. We are not involved directly with their operations out there. That is the group AMI that is contracted by the state. But our understanding is they have been using every single dose. They have basically a waiting list established of eligible people that are kind of on a holding pattern. I guess if they have an extra dose at the end of the day, they do have some eligible people that are available to take any extra doses if there's a vial open at the end of the day. So we have not heard anything that there's been any doses that have had to be disposed. They're all being used.
Thank you, Rick. We're going to go back to Ashley McCollum at the Janesville Gazette. Ashley.
Oh, there we go. So with the March 1st eligibility groups, as Rick had mentioned, congregate living is included in that, which I believe the state has included to, or has defined to include jails and prisons. I was wondering if there's been any discussions yet on how we will get vaccines to our community and our community members who are at the Rock County Jail, given that community obviously has some unique logistical challenges involved in getting vaccines to them. Was kind of wondering what the status is on that.
Yeah, I don't have any information directly. We can get back to you on that. I know that the Sheriff's Department is going to be in contact with different healthcare providers to get that accomplished. I don't have specifics on how that will be handled.
Okay, thank you, Rick. Were there any other questions from the media today? Well, it looks like we have another question from Ashley in the Janesville Gazette.
Yeah, hopefully just one more for me today. I know this is a little bit early on, but this week we got some positive news regarding the vaccine from Johnson and Johnson, perhaps getting emergency approval as soon as late this week. I was wondering if there's any kind of early discussion yet on how Johnson and Johnson vaccine could be used in Rock County and what populations maybe that would be better tailored for as opposed to our other vaccines, which we know have some logistical complications attached.
Yeah, the Johnson and Johnson vaccine is going to be a great thing for increasing our vaccine supplies. So it probably will be a little bit of time here before it would get down to the state and the county levels. Where that vaccine goes to will be determined by the state of Wisconsin. They make the determinations on where the Pfizer, Moderna, and now the Johnson and Johnson vaccines will be distributed to. So that's a little bit out of our control on where those go, and the state will be making those decisions.
Thank you, Rick. Looks like we have another question from Austin Montgomery of the Lake Daily News. Austin.
Thanks, guys. This is my last question here. Governor Evers was quoted earlier this week saying that the rollout of the clinic in Beloit, or in Rock County, excuse me, was a success. It sounds like from what you'd mentioned today about the major challenges being just the disruption from the winter storms down in Texas. Have there been any other challenges to the process in the initial rollout?
Yeah, being the first location, regional site in the state of Wisconsin, our location was definitely had a few more hurdles to get through, that kind of working out some of the process before some of the other regional sites open up. One of the issues is the state's registration system, vaccine registration system, as I mentioned earlier, is not yet up and running. So we've been using a temporary system for the first couple of weeks, and we're hoping that the state system will be up and going here shortly. But that has not caused many difficulties. And overall, I think the operation has gone pretty good. The main concern is getting enough supply of vaccine out to that facility, because they're capable of doing much more, and hopefully soon we'll be doing much more out at that location. There are going to be 4 new regional locations. The next one will be opening up March 9th in La Crosse. There will be another one in Racine County that'll be opening up later in March, and one in Marathon County, and then a cooperative regional location in Douglas County and Barron County. So those are new sites that'll be opening up, and they'll be learning from what's happening here in Rock County, and hopefully they won't have some of the challenges that we had with starting out.
Thank you, Rick. Okay, were there any other questions from the Beloit Daily News or the Janesville Gazette today? Okay, looks like there are no more questions, so we will conclude today's briefing. These media briefings take place every Thursday at 11 a.m. They are live streamed on our Facebook page and will be uploaded to our YouTube channel once the briefing is concluded. I want to thank everyone for your participation, and thank you to everyone who's watching via Facebook Live. If you are a member of the media and would like to participate in future media briefings, please send me an email to media.publichealth@co.rock.wi.us, and we will provide you with the link to participate. Be safe and healthy, everyone. Thank you.